Health, Vision and Strategic Priorities for the Future. Dr. Andrés Ursa CV. He is an MD, graduating from Madrid Complutense University. He is a teaching official in the health area of the regional government of Castilla y León. He is a director of the Institute of Integrative Medicine in Valladolid, Spain. He is a member of the Dr. Ramón y Cajal Illustrious Academy of Health Sciences, Madrid 2018. He is a recipient of the Dr. Gómez Ulla Health Excellence Award in Madrid 2019, and his work entails the treatment, teaching, and research activities. The presentation is split into an introduction, section Climate Change Runs Its Course, Health Systems Facing the Challenge of Climate Change, the Effects of Pollution on the Planet, Van Allen Belt Weakness, the health sector being the 5th largest producer of CO2 in the world, and proposals to tackle health consequences of climate change. Introduction. Since primary healthcare in Alma-Ata in Kazakhstan was given preference over specialized care in 1978, medicine in general has undergone numerous changes and continuous improvements in the different health systems of developed countries. Current climate change situation we are going through offers numerous catastrophe scenarios that the different health systems will have to tackle both in primary and specialized care. Given this scenario, it is urgent to introduce various improvements such as the instruction of health professionals in health emergencies, individual protection measures, introduction of other therapeutic resources not recognized in all countries, such as neurotherapy, ozone therapy, herbal medicine, osteopathy, homeopathy, etc., because the resources we have today may not be present in the future. We must debate the supremacy of pharmacological treatment as a quick measure of customer user care to the detriment of medical advice and/or non-pharmacological treatments due to the need to reduce iatrogenesis and pharmaceutical cost. The implementation of these measures would contribute to the economic and environmental sustainability of health systems, improve the health of the population, and governments will be able to face up to adverse global events with greater guarantees. Climate change runs its course. Since the Industrial Revolution of the 18th century, the concentration of CO2 in the planet's atmosphere has increased. The burning of fossil fuels, deforestation, intensive livestock, etc., produces greenhouse gases that contribute to global warming. The main GHG in addition to water vapor is CO2. Methane, CH4, produced by intensive livestock has a GHG potential that is 25 to 26 times greater than CO2. Some data to ponder. Livestock generates as many GHGs as all cars, trains, ships, and planes put together. Consequences of excessive consumption of meat and derivative. Processed meat is considered a human carcinogen. Red meat is probably carcinogenic, according to the WHO. Antibiotic resistance, also from the WHO. Livestock accounts for the emission of 14.5% of greenhouse gases, IPCC UN. A total of 80% of the land reclaimed from the Amazon rainforest is employed in soybean plantations used to make feed, in turn used to feed the livestock we later consume in Europe. Meanwhile, a good percentage of the Brazilian population suffers from hunger. By destroying oxygen-producing and CO2-fixing forests, biodiversity is depleted and we enter into contact with potentially harmful germs. Livestock requires a large amount of water. For example, to obtain 1 kilo of veal, 15,000 liters of water are consumed. This is completely inviable in the short and medium term. It contributes to climate change and to worse populational health. Health systems will have no human or economic resources. It is paramount to implement measures in primary care to raise the population's awareness and education. Governments must take drastic measures so that customers and traditions do not feed climate change. Further data to ponder. Spain is the EU country with the highest consumption of antibiotics in farm animals. This leads, among other harmful effects, to increased antibiotic resistance. Meat tax. Since intensive livestock farming contributes to climate change, excessive consumption of meat deteriorates our health, creates social inequality, and does not contribute to animal welfare. There has been talk for a long time in reducing meat consumption for the benefit of all by means of a tax. Spain is the leading European country and the 5th in the world that consumes the largest amount of meat per person per year. Impact of climate change. Over the period 2017 to 2018, climate change led to 4.9 million deaths in the world due to air pollution, since the environment has a direct impact on patients with cardiopulmonary diseases. Health systems facing the challenge of climate change. Are the health systems of the different countries and the WHO prepared for the different scenarios that can occur with climate change? The climate change-related COVID-19 pandemic has caused tension in health systems and the WHO itself, with doubts, improvisations, errors, and modifications, which are sometimes difficult to explain. Possible climate change scenarios and their relationship with health. Due to social, economic, and health inequality, different countries will have to tackle famine, the outbreak of new diseases or rare infectious diseases, the lack of health personnel and irregular distribution of health centers, difficulty in accessing medicines, climate refugee location, and wars over water. Effects of pollution on the planet. According to the WHO, air pollution accounts for a death toll of approximately 7 million people a year by breathing alone, breathing air with fine particles. Many more people on the planet are harmed by this phenomenon in some way. For example, premature births, etc. To climate change, we must add the problems already existing related to pollution. Pollution can be atmospheric, CO2, NOx, sulfur compounds, persistent particles, etc. Chemicals, heavy metals, herbicides, insecticides, fertilizers, endocrine disruptors. Radioactive material from nuclear tests, atomic bombs, nuclear power plants and research centers. No conclusive studies exist on the possible adverse effects of electromagnetic radiation on health. The precautionary principle applies. Noise pollution and its impact on health. And finally, information contamination and the influence of opinion groups. There are almost 6 million premature births due to air pollution. The ozone layer is still damaged. There is excessive use of propellants with CFCs, and this has led to deterioration of the ozone layer. The ozone layer prevents living things from receiving ultraviolet C radiation. In 1987, the Montreal Protocol was signed to control production and consumption of substances that destroy the ozone layer. Those that discovered this threat were awarded the Nobel Prize for Chemistry in 1995. As a consequence, scientists warned of the increase in skin cancers, and this is happening now. A pressurized inhaler leaves a carbon footprint equivalent to a vehicle traveling 300 kilometers. Weakening of the Earth's protective electromagnetic field. According to data from the SWARM mission of the European Space Agency, it has weakened by 5% in the last 100 years. There is a South Atlantic anomaly, most affected area of the planet. This could be a precursor to reversal of the magnetic poles. Consequences are damage to electrical systems and an increased prevalence of skin cancer. The Earth's magnetic belt, the South Atlantic anomaly. The health sector is the 5th largest generator of CO2. 15% of CO2 release into the atmosphere is attributable to the healthcare systems of developed countries. 21% corresponds to the life cycles of pharmaceutical products. Doctors and multinational pharmaceutical companies play a role in looking after the planet. Health without damage. The Healthcare Without Harm initiative is an international non-governmental organization that seeks to transform the global health sector to be ecologically sustainable and promote environmental health and justice. Solutions. The sector needs to transition to clean and renewable energy to meet the Paris Agreement goals and achieve net zero emissions by 2050 or earlier. Initiative innovation. The Harmless Health and Global Network of Green and Healthy Hospitals present a tool developed to assist global healthcare institutions with estimate of their GHG footprint. Global Roadmap for Decarbonization of the Healthcare Sector, 2021. This is aimed at Latin America and Caribbean countries. There is a need to promote systemic change whose response is based on prevention, preparedness, and equity in health between and within countries. Decarbonization of hospitals. COVID-19 vaccination waste. There is a guide with recommendations on how to better manage and safely eliminate waste associated with vaccination. Health Without Damage 2021. Proposals to tackle the health consequences of climate change are to inform and train health professionals on possible scenarios that may occur regarding climate change, to inform and train the global population on these scenarios from childhood. Health systems in developed countries must adopt strategies to reduce greenhouse gas emissions. All safe and effective therapies must be incorporated into health systems. Any delay in the implementation of these measures will contribute to the advancement of climate change. Thank you very much for your attention.